Hello, everyone, and welcome to Mind Your Mental. Just a reminder that this podcast is not meant to be a substitute for a relationship with a licensed mental health professional. I know they are hard to find, and I get that. I have a bunch of resources on my website if you need them, but I am not your clinician. I am a psychologist, but I am not your psychologist. So if you need any specific help, please look for the help of a licensed mental health professional. Learn all you can learn from the podcast. Enjoy the episode. So one of the things is, we're focusing on Black men's mental health, but as I'm a womanist, so I always state that what is best for Black women is best for Black men. What is best for Black men is best for Black women. And what is best for non-binary Black people is best for all of us. Mm-hmm. So don't tune out just because I'm not talking about Black women every single time. If you have a Black man in your life, a Black child in your life, these are things that are supposed to support them. What would be some signs that you feel as though Black men need to be aware of in terms of, like, you're in a relationship, like, I don't know if you've seen, it's called Ghost, but like, Molly, you in danger. You need to escape. What are some signs you feel like Black men may miss? Maybe like 3 signs that you think that they may miss in terms of being in an unhealthy relationship. Like something that you heard it in session and you like, why are you letting this person treat you like this? Like, you deserve to be treated better. Because I think sometimes they miss the signs.
Honestly, based on the work that I've done, I would say number 1 is being hit.
Okay.
And I know that doesn't sound like a sign, but truly, I think I've seen where men.
No, that's a sign. I know people. I've seen women go upside men's head and be like, I'd be like, yo, I'm out. Like, you're not. Yo.
Yeah.
Like, but I don't do that.
I say that because some men don't think that they don't see it as problematic because they're the man, so it didn't hurt that much. But nobody deserves to be hit, no matter what gender you are, no matter anything. No one deserves to be hit. So I think physical activity would be the first thing that's a sign. Also, if you're in a situation and you don't feel comfortable communicating your needs, a lot of the issues that we face is because we've had a lifetime of unmet needs. And if I can't communicate my needs and trust that you will either try to meet them or meet me or us just have an open conversation around it, then that's a sign, right? Or if I also feel like I have to walk on eggshells around you because I don't know what your temperament is going to be, that's a sign too. Like, if I don't know how you come in and I have to be careful about being authentic, so I don't even have the permission to be authentic because I'm trying to navigate your mood and those are signs that I would say. And even if I went on to say a 4th one, because I know you just asked for 3.
I always listen. Give me bonuses, honey. I don't mind.
If you make me feel guilty for just having a life outside of you, that's a problem. Mm-hmm. Yeah. If I can't go hang with my cousins or have company or go get a massage or go get a manicure or go to the bar, whatever, and then you automatically make it seem like it's something I'm doing against you, or those are insecurities you need to work out. Don't take that out on the man because you're creating this environment that he doesn't get to have anything else other than you. You can be great, but he gets to have more as well. So those will be some signs that I see on a regular basis where a man can start recognizing, all right, you know what, maybe I need to reevaluate this relationship. Are my needs being met? Do I feel safe? Do I feel challenged in a way that is healthy? Not just cussing me out every day or talking to me crazy, but hey, you said you wanted to do this thing. Let's talk about how I can help you do that. What are some of the barriers that you're having from writing that book or going back to school? Those are more encouraging, comforting conversations, but still hold you accountable versus what you ain't doing and who you ain't. Right. So it's that felt really strange to say that as a scholar, but here I am.
What you ain't doing? It sound fine to me. I say don't talk to people any old kind of way.
Listen, I cuss.
The unmet needs, I think, is one of the biggest things because I don't think men even think. I think there are many men who don't think about it because they're so used to being put in a position, just like you mentioned, where it's their job to meet other people's needs. Mm-hmm. So to not even think unmet needs, well, first, I've never thought if I had unmet needs. I've never even thought if I had any specific needs in the first place. The person, the sex may be amazing, but this person I'm with don't even read books, and I read books every week. I can't even talk to this person about a book. Like, oh yeah, they dress hot, but I can't take them to a barbecue because they don't know how to talk to people, and I don't need nobody cussing out my eye. unmet needs. Like if there are significant gaps where you're just like, I don't know if I can have this person in my life, I think that's something that people really need to hone in on. And it's hard. You may even have to start with identifying what your needs are.
Mm-hmm.
What are your needs?
For sure.
And if they meet in 1 out of 7, honey, get it together. Like that's a lot.
Yeah. No, but for real,
a huge gap.
I'll get the answer of, well, as long as they good, I'm good. Is that really true though? If we really uncover that, are you for real? Because you can correct me if I'm wrong, but that's not how I see it. And I get to explain what I'm noticing, and then the dots start to connect. So that's what I would say. I think that men are a beautiful species, and I saw that there aren't a lot of spaces for men to get what they need. Right. So even growing up, a lot of the reason why I'm connected to this work is because when my father died at the day before I turned 10, I realized that in that moment, I really lost the vulnerability to be a kid, because instantly I was parentified at an early age where I was signing up to take care of my mom any way that I could, take care of my brother any way that I could. And even though I had great friend groups and I knew that my mom loved me and she did the best that she could, I had a couple of good uncles, some aunts. Truly having a space where I could just and really be honest and authentic. I always said I wanted to be what I didn't have, which is what connected me to therapy. So anytime I get an inquiry or somebody reaches out, I melt a little because I'm like, okay, good. This is somebody taking that first step or being courageous, because the courage starts before you even call me. The courage starts when you realize like, yo, I need to see about this. Something isn't quite right. I don't know how to put my finger on it, but people have been telling me for a while, or I've been feeling off for a while. Let me do something about it. Another thing, I'm gonna come back to something. People in your life, a loved one or a partner or something, are weaponizing therapy. I also think that that's not healthy. Where you say, all right, if you don't go to therapy, I'm gonna leave you, or now. That's also murky, but we can come back to that another day. But we weaponize the idea of therapy. So then if you're talking to a kid and you say, well, hey, if you don't do this, I'm going to take this away. And then you get in therapy and you're only there to please your partner. I think that that's also risky, because you have to be bought into the process as well in order for it to make sense. Because what we really find out is that your partner was the problem. So now we working together in cahoots. How he can bounce out of that thing. So joke's on you.
Oh my goodness. Well, you know what? It is cahoots, right? Because you're a teammate. When people ask me about therapy, I'll be like, yo, it's just another person on your team, man. You see a pediatrician, you see a dentist, you see all these doctors. When I was working at in sports psych, it's like, listen, when it comes to Div 1 teams, when it comes to the NFL, the NBA, you know how many people on their team, if the filling up the ice bath, making sure they stretch in between quarters, making sure that the personal all that.
Yep.
The psychologist, the licensed mental health professional is the same exact thing. It's just having somebody else on your team, and I like that because look, you brought them in here, and what we decided the problem is you.
Yeah.
So we're actually we decided to switch
gears. Yeah.
This is no longer couples therapy.
A lot of couples.
Y'all are a couple. I'll leave the room if y'all need to discuss.
You're in a dictatorship. That's not a healthy relationship. So, because even when people reach out for couples, which I've started to do less of, but I'll ask, well, have you ever done individual? Because what we found is that people go to couples therapy, and if you've ever done, I think you've done couples before. I
did, and so to me, listen, I think everyone has their thing that they don't, their population that they prefer not to work with. I enjoy families, individual groups, families, and kids. And all of my colleagues were like, you couldn't pay me to work with kids or families. I think couples therapy is great, but it's so hard to specialize in so many things.
Yeah.
I can specialize in family before I specialize in couples because I had way more training in that realm.
Yeah. I was going to say that when I see couples come, they're really looking for you to take their side.
Referee, and I'm not doing it.
And it's really a struggle, which is why I've done less of it. But I've realized that when they're seeking couples, they really need individual.
That's a good point.
Let's start there for you to have a space just for you. And then later on, if you want to include that person or do couples, by all means, or doing couples simultaneously with individual therapy, I think is a really good way. Especially if you can access it, because you still deserve to have that one-on-one time where you can just talk crap, be honest, be challenged, learn skills, break down definition and unlearn things that you've seen so you can show up better. And I always tell people, my goal isn't to keep you together. My goal is to deepen your understanding of how you exist in this relationship. You get to decide what you do with that.
That's a quotable. I might have to take that out of the episode so I can steal it, but we'll see. I don't need any record if you say no, but that's perfect, because I think it's amazing to understand that, because when I've worked with families or when I've worked with couples, I was like, I really want you to understand that my patient is the family and the couple. I had sessions where at one point, like one of the partners couldn't come in, and I'm like, you still want to come in, that's fine. During the next session, when it's both of you, we'll review what you said during this individual session. And then just to clarify for everyone, if your clinician is taking you on as a couple, they cannot see you individually. If your clinician is seeing you individually, they are not going to be your couple's patient therapist either. So also be aware of that. Because I've had people be like, can you work with both of us? No, sir, no, ma'am, no ham, no turkey. I will not. I work with you as an individual. I can provide you with some amazing referrals for people who do couples therapy. But one of the salients of this relationship is the fact that we get to focus on what you need. And couples therapy is about the what the unit needs, what the system needs. So I can't objectively provide you with the care you deserve. Well, one, thank you so much for being here. I really appreciate just this perspective. I really like the fact that one of the biggest things I heard is that men need to understand that love doesn't require suffering either. Yeah. I think there's a big focus on that with women. And of course, with women, I think that's amazing too. But men need to know that too. Hey, everyone, just a reminder that Mind Your Mental is not just a podcast. It is also a amazing community, if I do say so myself. It's phenomenal. I mean, you get more access to me. What more could you want in this life? So if you want to join the community, if you're not already on the community, go to my social media. My social media is the same, Raquel Martin, PhD, and DM me the word community so you can get details on joining this amazing flipping community. You get more access to me, y'all. Like, I'm a delight. All right. Hope to see you there.